soon.
Okay.
Welcome, my dear audience and friends, to another episode of Cancer Convos with Grace B. This is your host, Grace B, coming to you from New York City, the city that never sleeps and is home to Cancer Convos with Grace B. I'd like to thank you guys all so much for, your continued support on all our social media platforms. For the newbies, this show aims to demystify the cancer disease and to bring on experts and stakeholders in the cancer space to come give their take, and also to raise awareness. So, although October was Breast Cancer Awareness Month, the conversation should never be over. And just so you know, November is Movember. And Movember is a movement that was started for the men to be proactive in about their health issues, and which helps to break down barriers and conversations surrounding these. So now, do you know that 38% of men believe they don't need to go to a doctor because they're healthy? And 25% of men say they have no time. Early detection is key to survival. So, for us who have brothers and friends and husbands and partners, we should remember to continue to encourage them to go for their medical checks. So, in this episode, I'll be hosting an amazing breast cancer advocate who will be sharing their journey to becoming empowered, paying the experience forward, and their call to action. I tell you, this episode is fully loaded, and I can hardly wait to dive deep into this convo. So, without much ado, ladies and gentlemen, I welcome Michael Singer. And yes, men have breast cancer too. Welcome, Michael. So glad to have you.
Thank you so much for having me, Grace. I appreciate the invitation and I look forward to our conversation.
Awesome. Thank you so much for coming on. So let's dive straight. Could you please share with us a brief info, please, your background, family, work?
Sure. So my name is Michael Singer. I'm Bronx born and bred. I come from the area Throgs Neck in the Bronx, and I'm a product of the Bronx school system all the way up to Bronx Community College, located here in the Bronx. And I worked for the federal government for 31 years. I'm retired now. I live with my wife here in the Bronx. And back in 2010, I was diagnosed with male breast cancer, believe it or not. And at that point in time, my only experience with breast cancer had been my sister, and she's older than me, and she died of what is called metastatic breast cancer or stage 4 breast cancer. And she didn't survive a year after her diagnosis. So when I thought I was going to be, when I was diagnosed with breast cancer, I thought I only had a year to live. And it was very scary, to say the least.
Absolutely. So please walk us through your cancer journey and what stage was it at when you were diagnosed?
Sure. So in 2010, I was going for a physical with my primary doctor, and I had a lump under my left nipple for a couple of months, and I was ignoring it. It wasn't painful. I thought it was just a fatty cyst. And I went to the doctor for the physical, and my wife said, make sure you talk to the doctor about that lump. And they took blood work. He checked my prostate. And believe it or not, Grace, I was embarrassed to tell my doctor that I had a lump under my nipple because men don't talk about their breasts. It was awkward. So when I came home, my wife said, "How did your appointment go? What did the doctor say about the lump on the nipple?" And I said, "I didn't tell him." She goes, "You didn't tell him?" She goes, "You're an asshole. You need to tell the doctor you have a lump
Mhm.
on the nipple." So with that, the phone rings a couple hours later, and it's the doctor's office, and they want me to come back in for further blood work. They saw something in my blood that needed attention. So I had no idea what it was about. I went back to the doctor's office, and they said, "Mike, we did your blood work, and we believe based on the results that you're diabetic, but we want to run more tests. And I was 50 years old and never had diabetes. And I said to the doctor, I said, Doc, while I'm here, I have this lump under my nipple. And he looks at me and goes, you have a lump under your nipple. And, when you go to the doctor's office, they want to know about family history, your mom, your dad, your siblings. And he knew that my sister had died from metastatic breast cancer 2 years earlier. So he felt the lump and he said, Mike, we have to get that checked out. Never saying anything about breast cancer, and not associating my sister at that time yet. He goes, we have to get that checked out. So I said, okay. So they scheduled me for a biopsy with a local surgeon. And I went a couple of days later with my wife, and he felt the lump and he says, all right, let me see if I can get anything in a needle biopsy. So he attempted to give a needle biopsy. And Grace, I have to tell you, that was not pleasant. I had never had a needle biopsy in my breast before, anywhere else in my body, come to think of it. And he goes, I can't get anything out of it. I'm going to have to schedule you for surgery and do a surgical biopsy. I said, okay, still never thinking breast cancer at this point. And went back a couple of days later and they did the surgical biopsy. And I was in the recovery room and my surgeon came in and I was still groggy from the anesthesia. And he said, Mike, I don't like what I saw. And that was really all he said at that point in time. And he couldn't talk to my wife, Patty, because he was going right back into surgery. He was booked that whole day. So I saw my wife later and I told the doctor said he didn't like what he saw. But again, there was no explanation. And I went back 10 days later to get the stitches out. And I was sitting in the doctor's office with my wife and he came in originally and he was very pleasant. And he goes, well, let me go get your file. And he comes back in. I could see his whole demeanor had changed, Grace. And he goes, Mike, I'm sorry to tell you, but you have breast cancer. And I was like,
oh, wow.
I looked at my wife and I said to her, I said, he must have my sister's file. How can I have breast cancer? I'm a man.
Yes.
And he said, no, Mike, men get breast cancer. He says, but I'm going to take care of this for you. Don't worry about it. And I could see my wife was already welling up because, she's a massage therapist, breast cancer massage, and she was familiar with it. And, she knew my sister's history. And when we left there, Grace, I was, again,
Wow.
I mentioned earlier, my only experience was my sister, and I thought I had less than a year to live, and I had to get my affairs in order and make sure my wife was well taken care of. I tried, this is 2010, I went on all the internet sites. None of the major cancer organizations had anything about male breast cancer, Grace. So I thought I was a freak. I was like, how can I have breast cancer? I don't know any other man with breast cancer. I've never heard of a man getting breast cancer. That day I walked into my doctor's office as what I thought was a 50-year-old healthy male and walked out as a breast cancer patient. I was in a state of shock. And at that point I asked my wife, I said, Patty, don't tell anybody that I have breast cancer, because I was embarrassed, Grace.
I know.
It was, stigmatizing. How could I, 50-year-old man, have breast cancer? And you don't see anything on TV about that. You don't see anything in magazines. There was nothing on the internet, any of the major cancer organizations. And I was scheduled for a mastectomy of my left breast. I think it was 10 days later. I went in and they performed the mastectomy. And I had 22 staples across my chest when I came out with 2 drain bottles in my chest. And the surgeon said, Mike, I got clear margins, but you're going to need to follow up with your oncologist for, whatever they recommend. But I think I got it all. And, being in the breast cancer space back then, I was like, okay, he got it all. And, life is going to go on from there. But it was a shock. And again, I kept it secret, Grace. I didn't tell anybody. Some people had heard, oh, Mike, you were in the hospital and you had cancer. And of course, for some reason, when people hear you have cancer, they want to know what kind of cancer you have.
Exactly.
I couldn't say breast cancer. So I would say chest cancer, which, as we know, is not breast cancer. It's a totally different type of cancer. My diagnosis was breast cancer, but I couldn't say it. And I said chest cancer for quite a while due to the embarrassment. And it wasn't until it was almost 2 years later, and I finally saw something on TV. There was a local TV show in New York City. You're from New York. You might be familiar with the Katie Couric show, which is no longer in syndication. And they had a teaser on TV that Katie Couric was going to be talking about male breast cancer. And I was like, oh my God, I got to tune in. They're talking about me. This is me. Maybe I'm not alone. And believe it or not, the show aired, Grace, and on TV was this young kid, basically. His name was Brett Miller, who had breast cancer. Richard Roundtree, who had breast cancer. And me growing up, Richard Roundtree was like this cool action hero.
Was an action hero, was a cool dude. Yeah.
He was cool. I mean, if you hadn't seen Shaft back then, you don't know what I'm talking about, but Richard Roundtree was this cool dude. And here are the both of them on national TV with this doctor from Memorial Sloan Kettering named Clifford Hudis talking about male breast cancer. And I was like running around the house, Grace. I'm like, why am I so embarrassed? Here's Richard Roundtree, one of the coolest dudes, and here's this young dude on national TV talking about. It was like a light bulb went off. It was like an epiphany. I can't be embarrassed about this. I have to talk about this. So at the end of the show, they ran the credits for the Male Breast Cancer Coalition, which Brett Miller, the kid on TV, had co-founded. And I called them up right away, and they were coming to New York. They were doing a fundraiser down in New York City, and they invited me, and I was like, I'm going. So my wife and I went, and believe it or not, that was the first time I had met another man with breast cancer. I actually met 10 men that day with breast cancer that were there for this fundraiser.
Yeah.
And at that point, I was like, I'm not alone.
Mhm.
It's amazing. And then at that point, I was like, I have to raise awareness, because I felt like a freak. I felt alone. I couldn't say breast cancer, and I was silent about it, and I was embarrassed about it. And shortly after I met these guys from the Male Breast Cancer Coalition, I became an advocate.
I'm going to talk about that now,
Okay.
because I don't want you to skirt over it, because I know you're doing so much work with that.
Sure.
So I don't just want you to brush that away. I will take you down that road soon. So
Okay.
thank God for that, epiphany you had to come out and, meet with the other breast cancer patients and advocates, about this diagnosis. But I want to take you slightly back to your mental health. Yes, you had a good support system with wife and the family and everything. But what did you, apart from the fact that you were embarrassed, what was your mental health like at this time? Because I'm very curious about this, especially the fact that you're a man and you have breast cancer and you felt like a freak. Apart from that, what was your mind telling you at that time?
I would say it my mind at that time was shock, because I felt alone. As we mentioned, I felt stigmatized because I had what I grew up to believe was a woman's disease. I might have been depressed to a point that I have a woman's disease at that time, not knowing the facts at that time. But only depressed that I felt alone, because I attempted to talk to women's groups with breast cancer, and I don't want to say they outright didn't want me, but there was an uncomfortable feeling.
I
Yeah, it was
understand.
an
Yeah.
uncomfortable feeling. They didn't want to talk in front of me, and I understood that. And I didn't want to be I didn't want to be a burden on people that, having been diagnosed with cancer is enough to deal with, and I didn't want to make anybody feel uncomfortable. So again, I was lonely at that time. I was looking for answers. You're looking for somebody who looks like you, a
Mm,
man with breast cancer, and I couldn't find them at that point in time of diagnosis.
mhm, mhm.
No support groups, so alone, um, confused, and
Okay.
like you mentioned, Grace, having a support system is one of the most important things. And my wife was an amazing support system and still is an amazing support system. She walked me through everything side by side, and I probably couldn't have done anything without her.
Yes,
And it just,
that's amazing.
yeah, your mindset is, it was confusing
Hmm.
because when your only familiarity is breast cancer is going to lead to death, a lot of things cross your mind, a lot of things.
Absolutely.
Yeah.
So, as regards your treatment, prior to all this, what did your oncologist recommend? Was
Okay.
it just a mastectomy? Did you have to go through chemo? What was it? What did it entail?
Okay. So they perform the mastectomy, and of course they do a biopsy on your sample. And I was diagnosed ductal carcinoma in situ, which means it was encapsulated. I
Mhm.
was ER positive. They say that 90% of men diagnosed with breast cancer are ER positive, as opposed to the differences between men and women with breast cancer. And my oncologist said, Mike, based on the pathology report, the margins were clear. I don't see a need for chemo and radiation. This beautiful head you see, Grace, is natural by the grace of God, uh, not
Stunning.
from not from chemo or radiation. So I was fortunate not to have chemo or radiation, but recommended to go on hormone therapy, a drug called tamoxifen, which is a pill that they prescribe to most ER positive men and women. Now you have to remember, Grace, they treat me, or they treat men exactly the same as they treat women with breast cancer. Even though biologically there are differences and
Hmm.
studies have shown that there are differences, there's not enough research on men with breast cancer, so they treat us like women. So I went on a hormone therapy pill. Originally, they recommended a 5-year regimen, and then studies came out and said that, well, 10 years would be even better.
Hmm.
And I was on that drug for 8 years. So no chemo, no radiation, but hormone therapy, which has an entire different set of side effects for men and women.
Yes, I know tamoxifen very, very well. A friend of mine, also a breast cancer survivor, has been taking that for the last 7, 8 years, and it's had some negative effects actually.
Yes.
She started like losing her eyesight. A lot of things were happening. So I can understand. But you're okay now. You've stopped taking it, or
I
you're
I
still.
came off of it. I just at that point I was you know, almost getting to 60, and I was like, what percentage? They can't give you a percentage as a man of how much this hormone therapy was going to keep the cancer from coming back. They said they could give the test to women, but they didn't have enough research to do this test on a man to say that. And at that point, I was like, the side effects were really slowly killing me. They change you physically, they change you psychologically, and every side effect that they had labeled on the medication, I pretty much was experiencing over the years at different times. So
Yes, I can understand. Oh my goodness, I'm so sorry to hear this, but no one would know that you had passed through such because you're still, I mean, you're active, you look great, and yes, you have that positive aura about you, and I'm very happy about that. Actually, what was the most difficult part of your cancer treatments, apart from the side effects? What was it?
Well, you, as a breast cancer um, thriver, I like to call myself a thriver, you become a professional patient, I like to call it, because your life becomes doctor's appointments after doctor, whether you're meeting with your oncologist, your endocrinologist, your primary care doctor, you just become a professional patient going from doctor to doctor. Um, Bone scans based on the medication you're on. Um, they were all difficult issues because your life starts to revolve around breast cancer. But you try to go on and carry on a normal life. And like you said, um, thank you for the compliment. I look and stuff. But what people don't realize, when you look at a man or a woman who's with breast cancer, it's hard to tell
It is.
that they're sick
Yeah.
because, breast cancer, you still look good, but you're dealing with it. When somebody's metastatic, unfortunately, until they're in final stages, they look good going through most of their treatment. Some of them grow their hair back. Some of them are wearing wigs and they look good and they're, out in public doing their thing. And people just have that misconception of, oh, so-and-so's a breast cancer patient. Oh, but she looks so good. Yeah, she's looking good, but the woman or the man is still dealing with breast cancer.
With
What people
so
don't
much.
understand is, yeah, I was early stage. I was fortunate. I have no evidence of disease right now, but unfortunately, people who are metastatic or stage 1, this is every day for them.
Yes.
Every day for the rest of their life. They will never come off treatment. They will never stop seeing doctors. It's just, I think it's a misconception, Grace, when people see, the pink ribbons and the rah-rah and the walks and everything, that everybody's cured. But unfortunately, there's 115 men and women dying every day from metastatic breast cancer, and people just don't realize that.
Yes. They see it as glitz and glamour for people like us that have had breast cancer, but they don't know that we're just trying to encourage ourselves, because
Right,
if not, this is what keeps us going, our mindset.
right,
And if every other thing fails, it shouldn't be this, because this is, we
right.
could
I
have
mean,
our we could have a support system, but
right.
if we don't encourage ourselves, what good is the support system? So it starts from us, right?
Yeah. People have to understand breast cancer is not pretty, whether it's for a man or a woman. It's a life-changing, life-altering.
Absolutely, absolutely. How were you able to, um, what should I say, embrace the pain and find the light in all of this? Was it when you attached yourself to um, the coalition, or what? Because I'm still coming to the coalition. I'm very, very interested about that. How were you able to embrace that light? And like you said, you had that epiphany, but it doesn't it I'm sure it didn't come immediately. It was a process. How did you go through that, please?
Right. So, in the beginning, when, after I told you I was diagnosed and my only experience was my sister, and my diagnosis was stage 2B, I realized, okay, so I'm not stage 4, I'm not metastatic.
Hmm.
I believe I'm going to live. The doctor says I'm going to be, fine. So at that point, I'm like, all right, I'm not going to die, but I still have to deal with this. Any man who's diagnosed with breast cancer needs to get genetically tested. So the first thing we did after my mastectomy was to get a genetic test, because if you do carry the BRCA1 or 2 gene, and BRCA just stands for breast cancer 1 or breast cancer 2, um, you know, your treatment will change drastically if you do carry the BRCA gene. So I came back negative, and this is back in 2010. I didn't have BRCA1 or 2, and at that time, the panel that they would test didn't really test for many other genes. In the back of my mind, I always wanted to know what the correlation was between my sister and I. I have two other brothers who don't have breast cancer. I am of
Or
Jewish
any other
descent.
or any other cancer?
Correct. My mom and dad both had cancer, but my mom was colon and kidney kidney, and my dad was prostate, but no breast cancer other than my sister in the family. And I'm embracing it in that the pain in that, all right, I'm going to live. I need to, start to move forward with my life, with my wife, but living each day that tomorrow is not promised. So make the best of today. So I had retired from work then, and my wife and I, started to enjoy ourselves, travel, because again, tomorrow's not promised. So make the best of today. And at that point, I had begun my work, so to speak, with the coalition, and I'll talk more about that when you ask later. But I think having the support system, knowing your diagnosis, knowing what the outcome could be, is one way of embracing the pain and being able to move on.
Yes. And another thing that I was on a panel recently. Another thing that helps us as cancer thrivers is during the process, having a say in our trajectory. Shared decision making also helps, that you are brought on board. Because in the past, you find out that a lot of patients that were going through not just cancer, other chronic illnesses, it was kind of dictatorial, in the sense that, oh, it's a doctor and the doctor knows best what's good for me and all that. But research has it, and evidence also has it, that if you are involved in your treatment, if you're involved in decisions concerning your healing and recovery, you tend to do much better.
Yes,
Okay,
definitely.
right. So
Go
what are
ahead.
the key statistics of breast cancer in men, would you say? Because now you're an expert by experience. What would
Well, I don't want to call myself an expert, and I'm not a
but
doctor or a
no, by
scientist.
experience,
Yeah, but the American Cancer Society does a great job in documenting and tracking the numbers. So here in the United States, 2,650 men are diagnosed this year alone, and the numbers have been going up since when I was diagnosed back in 2010. Those numbers steadily keep going up. And unfortunately, out of those 2,650 men, approximately 530 of those guys are going to die due to the latter stages of their diagnosis, because men were never educated on the early warning signs of breast cancer. As we mentioned earlier at your opening, a lot of men don't go to the doctor as they should be and get checked out. And we are considered the 1% of the breast cancer population, but it stinks to be in that 1%. There's nothing good about being in the 1%. And statistically, they say you have a 1 in 833 chance of getting breast cancer as a man. So those are the key statistics from the American Cancer Society.
And what do you think, when you were going through this, did you ask questions about, what could have increased your risk of having breast cancer?
Sure. You always want to know what some of the risk factors are. So, of course, family history, as you and I mentioned, the BRCA1 and 2 gene would be, number one as far as a risk factor. If you have family history, Grace, so important when you're at the holidays, whatever they are, whatever you celebrate in the family, sitting around the table, to ask questions, aunts, uncles, siblings. If there's cancer in the family, it should be talked about. It shouldn't be an embarrassment, because whatever you're going through might help somebody else. Age, now for men, they always said the median age of 65, but Grace, in my experience,
Earlier, right? And
we've got men as young as 18 years old with breast cancer. So, but they say these are some of the risk factors. Elevated estrogen levels in men, which could come from certain diseases like Klinefelter's syndrome, liver disease or cirrhosis, and low dose estrogen treatments for prostate cancer. Those are also some of the risk factors, and lifestyle.
Yeah,
They talk about obesity, lack of exercise. You mentioned that a little bit. Um, those are some of the things, and then of course there's always the environmental factor for men, which could be where they worked, where they grew up, chemicals they might have worked with, exposure to radiation. Um, a lot of those could be environmental issues.
absolutely. Um, I was also reading somewhere about the prognosis, breast cancer prognosis for Black men. And earlier on, you were talking about Richard Roundtree. When when he was invited to the Katie Couric show, because this is just coming back to me now, was he
Right.
able to mention, was there any comparison or difference in, discussing why Black men tend to do less better than white males as regards breast cancer? What is there a difference?
Yeah, going back to that TV show, it was mostly discussed just about being the rare disease. Research has shown that African American men definitely have a worse survival rate, I should say, than white males. I don't have any research behind that, but I can tell you from personal experience, Grace. I'm located in the Bronx, so I do a lot of inner city health fairs and talks at the hospitals and stuff. And African American Hispanic men tend to walk away from my booth, because I'll have a booth with talking about male breast cancer, and the significant others, the wives, spouses, come over and they talk to us and they bring the information back to them. But I just see it seems in that community that the men are less vocal about. Again, I didn't want to talk about my breasts. They don't even want to call it breasts. We work with
Yes, yes,
some prominent men who refuse to call it breast cancer and continue to call it chest cancer, which really sends a mixed message. But I wouldn't want to quote the numbers, but yes, the African American men do have a worse prognosis with breast cancer.
yes, yes. And I'm happy that the partners and the spouses of the men are being more vocal. Usually the women are. We can understand why they are not, but so far as you keep doing what you're doing and spreading the awareness, I'm sure it's beginning to open up. Now, tell me, tell us more about the um, Male Breast Cancer Coalition. What is the
Okay,
mission? And as lead advocate, what is it that you do? And what message do you share?
sure. So the Male Breast Cancer Coalition is a not-for-profit organization of patient advocates
Mm.
and patient advocacy organization, and they bring everyone together to educate the world about male breast cancer. On the website, you will see several hundred stories of men just like myself, all different races and ages, sharing their personal experience about breast cancer. They also have an in memorial page for, unfortunately, the men who die from metastatic breast cancer. Um, there are links for families to click on to, get different resources. Sometimes they're financial, sometimes they're spiritual. We do have some doctors on board who will review cases and give second opinions to these men. And as a lead advocate, I go around to I go to conferences to learn the latest about breast cancer, both in men and women. We usually set up a booth, whether it's at the San Antonio Breast Cancer Symposium in Texas or ASCO, which is the Association for American Association for Clinical Oncology, and we set up a booth. I go around to hospitals, senior centers, high schools, civic um, organizations, and I will talk about male breast cancer, because you have to remember, Grace, I went from being embarrassed to now being empowered, and from being silent to now being outspoken. and talk about my disease without being embarrassed. So we connect with other men. I'll take phone calls from newly diagnosed men, or we'll put men in contact with other men, maybe geographically near them, to talk to them. And we try to, lend some guidance to families as to, what they could do, what they should do. I don't want to give, like I said earlier, I'm not a doctor or scientist, so I don't give any medical advice, but I can tell them experiences that different men have had with, different medical experiences. So it's a great place. Like I said, I thought I was alone. Now there's a landing page on the internet where men can go and see other men like themselves. And because, like I told you earlier, it's very difficult for men to get involved in a support group that has women. We have a monthly Zoom meeting where men can dial in, not only here in the US, but we're international. We have men from other countries who dial in also to talk about their experiences, because Grace says, the more you talk about yourself,
Something, the more you demystify it,
you demystify it, you feel better about yourself, other people. Like I said, I thought I was a freak in the beginning, and now I see there are, thousands of men just like me, but there's still a stigma attached, Grace. If I go to get a mammogram, or I like to call it a manogram, the forms are still pink. The form asks me when I had my last menstrual cycle, if I'm breastfeeding. There's still a stigma attached.
They want to
Yeah,
take your blood for if you're pregnant.
yeah. So you can see how there's a stigma attached, and as we talked about, men of color, they don't want to hear that or be subject to that. So until we turn this into a people's disease and not just a woman's disease, or man's disease, when you go to the doctor, Grace, the doctor should check men from head to toe, not just the prostate, not just our ears and our eyes. They need to check out breasts, check out lymph nodes, and make it part of a full examination, because until men know the early warning signs of breast cancer, whether it's nipple discharge or a lump under the nipple, or redness or swelling or scaling around the breast, they need to know that. Just like a woman was taught at a very young age how to do a self breast exam, men need to be aware. And if you're a high risk man, and when I say high risk, I'm talking a family history of cancer in general, or breast cancer, men need to know that, because a man can pass BRCA1 or 2 onto their offspring the same as a woman. It's a 50-50 chance. If the man's got a history of breast cancer in his family, and the woman, it could be the man passing the gene on. And I know several men who are good friends of mine who carried the BRCA gene, and unfortunately passed it on to their daughters and or sons. And makes them more proactive, that they know there's a family history, to go to the doctors and get checked. And I do know several men and women who, because they carry the BRCA gene, have such a high percentage of developing breast cancer, that they go for a double mastectomy, and some of them an oophorectomy, or some people like to call it the Angela Jolie surgery. She made it popular that you would get a double mastectomy and an oophorectomy.
Take everything out and forget about it. Yeah.
Right.
Mm-hmm.
Yeah.
Have you ever been invited to be in a clinical trial as regards breast cancer?
Yeah. So there weren't many clinical trials for men to begin with, but there are some out there that were accepting men. Now, in August of 2020, the Food and Drug Administration, that handles all the drugs, you hear them always talking about the new vaccines and stuff, they came out with a draft guidance for the industry. Drugs for breast cancer, you have to include men unless there's a really strong reason, maybe biologically, that they shouldn't include it, which is, number one, raised awareness for the scientists and researchers to include men. It raises awareness, for the population that, oh, they're including men in this clinical trial. And then there are more clinical trials that are looking for men. Now, I never was part of a clinical trial where I had to give blood, but I'm part of clinical trials that are surveys that talk about my experience as a man with breast cancer. And a lot of guys do that. But we do have men who are part of clinical trials. And again, that opened up really in August of 20 when the Food and Drug Administration pretty much said, you have to include men if you're going to develop drugs or treatments for
Yes,
people with breast cancer. Because,
absolutely.
the clinical trials have different phases. Like phase one might include, a couple of men, and it goes all the way down to phase 4. When you got down to phase 4 in clinical trials, there was almost no men in these breast cancer trials. And you can see that on clinicaltrials.gov. It's a public
I do.
spot where you can go look at clinical trials. So yeah, so to answer your question, I haven't physically, we have men who are, but most of the stuff I do are types of survey type of trials.
Yes, I wish much more opportunities would open up with the FDA so that you know, for the next generations to come,
Right,
that there are less cases and there's more awareness and they can find some kind of, I mean, look at us, we're breast cancer survivors and thrivers, and that's due to um, research that has gone on in the past. But for you, this is a much narrower, what should I say, case, niche,
right.
which is just go. I mean, it's rare, basically. It's rare
We're,
compared
we're
to
1%. It is a rare disease.
yes,
But as a patient advocate, I've been involved in working with researchers and scientists on
great.
clinical trials. So I was on several panels for the Department of Defense, which is one of the largest funders for breast cancer clinical trials. It's a peer review, and I would sit in the room and review different. So a scientist or a researcher puts forth, this is what I want to do to find a cure or a treatment or, follow a gene. I need money to do this. And then they would send them to, in this case, the Department of Defense. And then we sit as a panel with doctors, researchers, and a couple of patient advocates. And, as a patient advocate, I'm looking to see how invasive is this trial that you want to do? Is it going to, hurt the patient? Is it going to cause problems in the long run? Is it something that's going to advance cancer research? And it's amazing to have a voice in that process, like you mentioned. And it's amazing to see the doctors and researchers who are trying to find a cure. They're so passionate about this. And to hear the conversations going on across the table, it just amazes me. And it makes you feel good to know that there are people in your corner looking to find a cure or to make a certain maybe stage 4 metastatic or chronic disease rather than a killer. So it's nice to know people are out there, and you meet these researchers all the time at the conferences. They're from all around the world.
Absolutely. It gives us hope that, generations to come, there'll be less that I mean, as by God's grace, there'll be no more cancer in the next 10, 15 years.
Right.
It takes a lot. So far as there's adequate funding, we keep funding. I
Well,
think
funding
that
is important. There are some male breast cancer research programs going on, but for some of them, the funding's not there. They start and then the funding runs out, and then it's difficult to get them because it's a rare disease. But when you look at the numbers of how much money goes to breast cancer research or metastatic breast cancer research, it's not divided fairly amongst all the different stages of breast cancer. So
yes, indeed.
there are disparities out there.
Quite odd, honestly, quite odd, but I'm sure we'll get there as time goes on. You mentioned earlier that you have diabetes, do you?
Yes.
Okay, so how do you did it? How do you manage it with
So
what's
I was
happening now?
diagnosed with type 2 diabetes the same time I was diagnosed with breast cancer. Um, I didn't know much about it before. I manage my diabetes through A, medication,
Mhm.
B, diet, C, exercise. It's the only way to manage it. You can do all three. You could do one of the three, but you need to do that, and then you need to monitor.
Yes.
There's daily self checks. There's quarterly self checks called the A1C test, which will give you a parameter of how well your blood sugar was during this 3 month period. But if you don't,
Whatever.
yeah, if you don't watch what you're ingesting, and when I say that, I'm talking, things change it. Sugary drinks will change it. Alcohol will change it. Uh, Snacks will change it. Carbohydrates will change it. So you have to kind of keep a running tally in your head daily as to what you should eat or not eat. Well, it's difficult sometimes to push away that piece of cheesecake
It is
or
difficult.
a beer or a glass of wine or something, but you have to train yourself. It becomes a way of life, so to speak. So I'm living with diabetes now 11 years. I maintain it. I'm still type 2, but I go to the doctor regularly. As you mentioned, I'm a man and it's Movember, and I go to the doctor regularly
Yes, indeed.
for checkups, and I, maintain what I think is a good blood sugar. But yes, I take medication every day, and I'll be taking it for the rest of my life.
Absolutely. My father was diabetic, and during his time, there weren't so many innovations and all. And he realized it late in life when he was a diplomat, so alcohol, rich food, everything. And then at 60, retirement, boom, when you should be, living your life,
Right.
you're now, it's crazy. Yes. So an ally of, the diabetic
Yeah. Your
foundation.
message in the beginning is so important because men need to go to the doctor. Men need to follow up with these things, whether it's uh Movember, whether it's June is another men's health month.
Exactly.
Diabetes is no joke.
It's a killer.
Yeah,
It's a
men who
killer.
lead a lifestyle of smoking and drinking and eating rich foods, it catches up. So if you're aware of it and you're doing anything's okay in moderation. It's when you overdo it is when you cause problems like that. But getting
Absolutely.
guys to the proper health care is so important because some of these diseases and cancers are treatable. Colon cancer, to go for colonoscopy, nobody wants to talk about it, and prepping for it is unpleasant. But if you've got something there and you're having a colonoscopy, lots of times they can diagnose it, they can treat it, they can cut out polyps, and it's a killer. I don't remember the actor's name who was in
Chad Bossman.
yeah, a
Chadwick.
young man. He was a young man. He had
Yes.
no idea.
Yes.
Had he been diagnosed early or going for colonoscopies, he'd still be here today.
Exactly. That's I find out that a lot of people just wish things away, and it shouldn't be the case. Sometimes we're our own worst enemies. That's
Yes.
why I keep harping on. Make sure, don't assume that you're young and healthy and nothing can. A lot of things. Look at the 18-year-old boy you were talking about that had,
Yeah.
breast cancer. I mean, imagine that. I interviewed a young guy too that had testicular cancer, and he was 20, 21, 22. I
Right.
mean, unfathomable.
Yeah.
So,
It's an
yeah,
important message. You have to keep pushing it out there, Grace. You have to keep doing what you're doing. You're going to reach people, and men need to be aware. Prostate cancer, colon cancer, breast cancer. There's so many cancers, and they're killers left untreated. And there's some of them. There's no reason that you shouldn't be able to get treatment. And as far as a man doing a self-breast exam, if you go to the website malebreastcancercoalition.org, there's a free downloadable card that shows a man how to do a self-breast exam. There's a video that the young man Brett demonstrates how to do a self-breast exam. And we have these cards, and if you turn it over on one side, it's pink for women, and if you turn it over, it's blue on the other side for men. It's very important. And if guys are embarrassed to, touch themselves and do it, have your significant other do it. I can't tell you how many men, their story is that the wife felt the lump on their
Yes.
chest
Yes.
and told them, hey, you got to get that checked out. Because guys just, we don't touch ourselves sometimes like that. And it's something
Exactly.
that be treated. Yeah.
Yes. And there was a story I was reading about. A guy found out that he had it, but he was into bodybuilding. So he thought he had injured himself, maybe a tendon or chest muscle or something like that.
Right.
It was when he went for a checkup that he was told that he had breast cancer. So these are, just like you rightly said earlier, when a man goes to see the doctor, it's not just prostate and all that.
Right.
He should check him from top to toe. That is the message.
And guys, I was such a fool in the beginning, Grace. You can't be embarrassed. It's your body. It's your doctor. You really need to be able to talk about these things. And, if my wife didn't push me to say, hey, you got to tell the doctor about that, who knows how far my, tumor could have grew. And, if I would be here today, so it's important to have a good support system, whether it's your significant other telling you to go to the doctor, or a family member, or your child telling you, you need to do it. Because look, everybody's got either a father, a brother, an uncle, a male friend, a husband. They need to have that conversation and go to the doctor. Medical care is out there. Is it all the greatest? No, but you need to get to the doctor, run some blood tests, go for some of the tests. It could save your life for sure.
Absolutely. Oh, thank you so much, Michael. This has been wonderful. So let's have some fun before, I allow
Okay.
you to have the rest of your day.
Okay.
So, rapid fire questions: beach, desert, or mountain?
Mountains for me.
Mountains, right. Okay, Beach Boys, Rolling Stones, Beatles.
Definitely Rolling Stones.
Oh, best. Yeah, that's in your character on your motorbike and all.
Yes, I do use the motorbike to generate conversation. I have a pink and blue ribbon, which is for male breast cancer, and people see that, or they see it on my T-shirt, and it starts the conversation.
That is nice. I like that. So, what is one word that best describes you?
There's so many words my wife uses to describe me, but if I was
Wow.
going to describe myself, I'm going to use thriver, like you used before. We're thrivers.
Yes, indeed. That's fantastic. That encapsulates everything,
Yes.
honestly, in that message. So, last but not the least, read somewhere that in 2022, 18 million people will hear those terrible words, you have cancer. Now, before we close, what would be your call to action?
I hate hearing the numbers that large, number one, but my call to action would be educate yourself. Knowledge is power, and you are your own best advocate. If you hear those words, you have cancer, don't be afraid to get a second opinion, because, doctors are human. You might hear something from one doctor and something different from the other doctor. So educate yourself and be your own best advocate. And don't go to a doctor's appointment like that alone. Bring somebody you trust. Because like myself, Grace, when I heard the words, you have cancer, my
Oh,
head just
yes.
went blank. And I started thinking about dying. And my wife was listening to everything the doctor was saying after that. I had to ask her, what did he say? Because,
Yeah.
so bring somebody with you too. That's very important.
Absolutely. Thank you so much, Michael. And it's a wrap. Thank you so much for coming on, Michael. We're truly blessed, and I'm sure our audience is going to take so much away from this conversation. And before I close, I would like to share a word with the audience. So, my dear audience and friends, there you have it. You've been listening to Michael Singer, lead advisor and advocate of the MBCC, which happens to be the Male Breast Cancer Coalition. You'll be hearing more from him because I'm going to be having him on my show notes on all my social media platforms. And he'll be out there for you to reach out to him, if you will. So have a good one and stay blessed till the next episode. Ciao, ciao. Thank you so much, Michael. Bye. That was nice.
Oh, good. Did you get everything in?
Yes, I did.